Chapter 2. What is therapy, really? When you can't change your circumstances, change your perspective. I got this advice from a supervisor of mine at a summer camp for kids with special needs, primarily those with autism, when I was 20 years old, and it is still some of the best advice I have ever gotten. It's safe to say that I was a control freak, and it caused me a lot of stress. It seems so obvious now, but you can't control everything. You can't even control most things, but, like most people, this was a lesson I had to learn the hard way. I was working with a kid named William at the time, and he had a special ability to push my buttons. He could irritate me in ways I didn't even know I could be irritated. I like to think I'm a very patient person, but I could only talk with William for about 10 seconds before I got heated. I wanted to excuse myself from the room, but when your job as a camp counselor is to look after the campers, you can't just walk away from them whenever you get upset. It's like he's trying to piss me off, I vented to Tate. I don't know what I did to make him not like me, but he hates me and he's trying to make my life a living hell. I can't take it anymore. Then Tate just smiled and asked me if that was the only way I had considered my interactions with William. I must have looked confused because he continued. You don't know his intentions. He may very well hate you and want to piss you off, as you said, but what if he doesn't? What if you assume the best of him? Do you have anything to lose from doing that? I was stunned. I hadn't considered looking at our interactions any differently. I knew that he was purposely trying to get under my skin, and it was eating me up. I forgot to consider the possibility that I was wrong. That's when Tate dropped some knowledge on me. When you can't change your circumstances, change your perspective. How else can you perceive William so that you don't get as upset with him? He and I then talked for a few more minutes about ways I could assume William's intentions to be different, ways that might not irritate me. It doesn't matter if your new perspective reflects the truth of the situation. William could very well hate you, but it's going to make your life a lot easier to just tell yourself that he doesn't know any other way to communicate with you. Give him the benefit of the doubt. It's as much for your sake as it is for his. Maybe even more for you. The lesson I learned here was on the power of reframing, which is a popular tool in strategic family therapy. As the name suggests, the therapist of this technique develops a strategy he or she believes will be effective in making the family's problem less problematic. The strategy requires the family to change the way they relate to the problem in order to solve it. One simple way to change the way people relate to a problem is by shifting the way in which they perceive it, because perception is everything. Not long after I decided to consider the possibility that William was not actually trying to piss me off, that it was just an irritating side effect of his personality, I guess, I was able to find ways to behave proactively rather than just reacting to him. Strategic therapists believe that the problem the family thinks is the problem is not really the problem. Let me say that again. The problem that the family thinks is the problem is not really the problem. What I mean here is that the manner in which the family reacts to a problem becomes the problem, and they get so caught up in the pattern of reacting to it that they forget that that's not their normal pattern. I'd like to clarify another point that is integral to strategic family therapy, but also relevant in some capacity in many other models of family therapy. It is not the content of the interactional pattern that matters so much as it is the context. Let me clarify this now. When your wife or boyfriend, partner, significant other gets mad at you about the dirty dishes in the sink, it's not about the dishes. The dishes are usually a metaphor for something else, or they're just the straw that broke the camel's back. No one really gets that mad about the dishes themselves, but they can get mad about the lack of effort you show around the house, or that you didn't follow through on your promise to wash the dishes, or that you don't seem to respect what your partner does for you. Whatever your partner is actually mad at you about is coming out in their perception of what it means that you didn't do the dishes. I swear to God, one of these days I'm just going to take all the dirty dishes, throw them on his side of the bed, and see how he likes it. He doesn't respect me. My mother was right. I'm going to leave his ass. One partner sees the other partner's behavior as disrespectful. It doesn't matter whether the dirty dishes were there accidentally or intentionally. We each attach our own meaning to things like this, and at least 100 other things throughout the day, and we react to our own perceptions like they're reality. The dirty dishes could have been dirty laundry, forgetting to go to the grocery store, or to put gas in the car. The content of the fight doesn't matter. The pattern here is, one partner doesn't do something they maybe should have done, the other partner perceives it in a certain way, and the couple has a fight over one partner's potentially erroneous assumptions of the event. Sue Johnson, founder of Emotionally Focused Therapy, refers to these as missteps in our relational dance. By recognizing their pattern, the couple can be better prepared to handle it and not allow it to escalate every time. Damn it, she didn't put gas in the car. It's okay. I know she respects me. She probably just forgot. I'll gently remind her later to put gas in the car next time because I have to get gas on the way to work now and I'm worried I'll be late. Or you can turn it into a fight, but if you'd like to avoid that, try to pay attention to the pattern you tend to engage in. Either way, it's never about the dishes. Speaking of fights, you know when you anticipate one with your significant other and you're rehearsing the fight in your head? Maybe you've been stewing about something for at least 10 minutes and maybe up to 6 days or 2 months, I don't know. So anyway, you've rehearsed in your head how you think the argument will go, and you're banking on them following the script as though they could. Well, because of the reciprocal nature of human interaction, we're constantly responding to each other, and you cannot not communicate. For example, as Allison yells at Jared about something, Jared might have been thinking of saying something calm and rational to ease the situation, but then Allison hit a nerve, and now Jared wants to be vindictive and deliver a verbal low blow right back. He doesn't, though, and he decides to give Allison the cold shoulder because he knows how much she hates that. Even though he didn't respond verbally, Allison got the message that she did something to hurt him since he's giving her the silent treatment now, and she knows he only does that when he's really hurt. Communication is constant, and as a result of the change in Jared's behavior, Allison now softens. Jared, sweetie, I'm so sorry. I didn't mean it like that. Can we get something to eat? I'm hungry, and it's not exactly putting me in my best mood right now. I'm so sorry, babe. I believe most people are capable of overcoming most of their problems. I believe they have good intentions and simply don't yet know better ways of turning them into meaningful action. Tate's advice to try shifting my perception helped me immensely. That first summer at the camp, I felt constantly overwhelmed and thought I'd never be good at the job. Upon shifting my perspective on things, I found myself thriving, and I went back for another 3 summers after that. My point is, therapy isn't some scary, mysterious thing that people should be ashamed of. At its core, therapy is about helping people to change the way they view themselves and their circumstances. Clearly, how they see it now isn't working for them because they feel like there's a problem. However, in learning to more clearly articulate what we want and then believing that we deserve it, we start to engage in behaviors that move us closer to the things that we want. Life can be really hard. Everyone knows on some level that this is true, but for some reason we tend to act like it's our fault that it's so hard. It's not. We live in a sick society with mismanaged priorities, remember? Therapy exists to help people navigate these necessary, difficult discussions. Therapy is one of those things that everyone seems to have an opinion on, even if they've never been themselves. We see therapists portrayed in books, TV shows, and movies, and I gotta say, it's rarely done accurately. I mean, it makes sense. Obviously, the therapist who has affairs with her patients or divulges his client's secrets makes for good watching, but it does nothing to help the field of therapy. It makes people hesitant to trust a therapist, even if they're not consciously aware of their distrust. How does that make you feel? Just kidding with that last question, though. This question is probably the hallmark idea people have of therapy, and yet, as multiple teachers of mine have put it, it's a useless question that irritates everyone and does nothing to move people forward. Think about that for a second. Say we're talking about your relationship with your mother, to call on another trite idea of what therapy is, and I ask you, how does that make you feel? Whether your response is sad, mad, unloved, or anything else, what does knowing that do for you? A much more realistic question might be, what do you want to do about it? Effective therapy is, in my opinion, much more about action than insight. And while small doses of insight can certainly be useful, knowing more about your subconscious does little to resolve most problems. Sometimes you have to recognize when there's no right or wrong decision. You just have to choose one and make the most of whatever happens. This is not to suggest there are no clear black and white options, simply that they're not as common as people might like to believe. The field of marriage and family therapy, or MFT, is not just couples counseling. Yes, we obviously do that, but we have an entirely different point of view from conventional psychologists. I don't know all that much about traditional psychology, like if that's even what it's called these days, so I apologize to any psychologists whose careers I might unintentionally diminish here. From what I do know, I vastly prefer the approach that MFTs take because we do not believe in pathology. It's a seemingly crazy concept, no doubt, but with radically positive implications. If you go to a regular psychologist, they're likely going to listen to you talk about your problems so that they can try to determine what to diagnose you with. The DSM, or the Diagnostic and Statistical Manual of Mental Disorders, is like the psychologist's Bible, and in it is criteria that you have to meet in order to be given a certain diagnosis. In this sense, psychologists are like doctors for your mind. This is not an altogether bad idea. Doctors serve a clear purpose, and society needs them. However, there's not such a strong stigma about getting cancer, having asthma, or becoming arthritic, while there is still a huge stigma regarding addiction, depression, or any other form of mental illness. There's stigma about having AIDS or being obese, you might want to interject, and that's a fair point. Some medical conditions are stigmatized. Taking AIDS and obesity as our examples, people will often assume that recklessness and laziness, respectively, played a role in the person who suffers from either of these conditions. When I was in my grad program for kinesiology, I was taking a sports injuries class, and my teacher said, "There is not a single physical injury that does not take a toll on the mind, and not a single mental illness that does not take a toll on the body. The two are inseparable and should be treated together for people to experience true healing." When a medical condition is stigmatized, it's because of the often false correlation people draw to the person's character, the essence of their being. I'm really proud to be in the field of marriage and family therapy. It was founded by therapists and other thinkers who rebelled against the way therapy was being conducted. They believed that you tend to find what you're looking for, so looking for symptoms to justify a diagnosis will often result in a diagnosis. Choosing to see people as inherently strong and resourceful, however, led the early MFTs to empower their clients to leave therapy feeling capable and hopeful. We're taught to find flaws in ourselves in so many ways, so when we put all of our energy into that, we forget that we have strengths and that we can do hard things. We'll get to Glennon in the next 2 chapters, the woman I borrow this phrase from. Sometimes, we just need to be reminded of that. Judgment is prevalent in our society, and it does nothing to help people heal. Giving someone a label, like schizophrenic, OCD, anorexic, neurotic, depressed, or bipolar, just makes it easier for other people to judge them and to pretend to know more about the person than they really do. As you read those labels, did you find yourself having opinions on them? It's hard not to. It's no wonder that many people suffering from mental illness feel they have to keep it to themselves. It's far more likely that someone will experience judgment and rejection if they openly acknowledge their illness, when all they really need is help and acceptance. Shame is a powerful thing. In fact, Brené Brown, who sometimes refers to herself as a shame researcher, says shame is the most powerful master emotion. It's the fear that we're not good enough. That is, perhaps, one of the biggest problems with having a mental illness in our society. There is so much shame attached to it that anyone who suffers from any form of mental illness immediately starts to wonder, what's wrong with me? Why can't I be like everyone else? What did I do wrong? Shame encourages us to keep our suffering to ourselves, which only serves to make it worse. It isolates us. Shame told me that I don't deserve love, that I'm a burden on my friends and family, and that I shouldn't want to put my problems on their shoulders. When we come to the conclusion that no one will help us if we ask, we become hopeless. We accept the diagnosis and throw in the towel. This is my life now, we say. All I can do from here on out is manage my illness. But it doesn't have to be that way. I think that a DSM diagnosis is as useless as asking, how does that make you feel? Every single person on the face of this earth experiences stress to some degree every day of their lives, and for those of us for whom it becomes too much, it manifests itself in different ways. Some people become addicted to substances as a means to escape stress, sadness, or fear, and to numb their pain. Others will suffer from anorexia, caving to the intense pressure of society's idea of beauty, and starving themselves in a vain attempt to become beautiful. Still others will experience OCD, which is not simply a preference for a certain level of order. People with this condition are fearful and have developed the notion that if they do things a certain number of times or a certain way, it will prevent their disturbing thoughts from recurring. A DSM diagnosis only tells us how the person experiences their stress and does nothing to resolve the issue for them. It acknowledges that they're having a hard time living in this society, and it says that the problem is them. As we discussed in the last chapter, it seems increasingly plausible that the problem is their socio-political climate and the attitudes of the people they live, work, and socialize with. People are not separate from the societies they live in, nor are societies separate from people who compose them. There is a problem between the two that is being ignored, and the individual becomes blamed for the problems of the whole. Marriage and family therapy started when some psychologists were working with patients diagnosed with schizophrenia who weren't getting any better with treatment. Eventually, someone got the idea that perhaps the problem was the patient's home environment. It doesn't matter what the patient works through in the mental hospital if they go right back to the home that made them schizophrenic in the first place. As a result, therapists started asking whole families to come into the hospital, and the therapists observed their interactions and concluded that it was indeed the stressful home environment that made the individual ill. Schizophrenia developed as a result of what is called a double bind, and it causes communication to lose all meaning to the individual. A classic example is the boy who is told he talks too much, but then criticized for sitting silently at the dinner table. It's a damned if you do, damned if you don't scenario that, over time, wears on a person and they snap. The problem then is not the boy, but the relationship he has with others, and when it stops adhering to reality, his mind is unable to make sense of the world he is living in, and he begins to dissociate. If you think about it, we kind of live in a schizophrenic society. We value youth, but mock people who try too hard to hold on to it. We value being skinny and fit, but criticize those who cheat by getting bariatric surgery, or we assume that every guy who's bigger than us used steroids. A woman is either a prude or a whore. You're either cheap or you're terrible with money. A black man either fits the stereotype of being a criminal, or he was referred to as a credit to his race. No one wins with any of these views, and there are many more like them that we're all being subjected to every day. With all this stress and the competing messages, it makes perfect sense for many of us to feel like we're screwed before we even begin. You're told to strive for something, but all your effort will be discredited. You'll be criticized no matter what you do, and you're led to believe that you'll never be good enough. It's hard to want to try when that's what's ahead of you. Trust me, I know. Some people seem to manage this stress better than others, but by now, it should make sense why so many people can't. It seems we're all set up for failure, and when we experience this stress on a regular basis, it can start to affect our relationships. Relationships which should otherwise be a source of comfort and healing. Society seems to believe that a man's value lies in his ability to achieve, to provide for his family, and to get his partner off. Take a man who's suddenly laid off from his job, and his sense of value plummets. He's not achieving, and he's not providing, and it's quite likely he'll soon develop sexual impotence if he's unable to restore his sense of value. He and his spouse will feel distant and frustrated. He'll feel ashamed and embarrassed, and all because of the idea society holds of what it means to be a man. Will he think the problem is him or society, though? When he can't get it up and sexually satisfy his partner, he's going to assume that he is the problem when he didn't actually do anything wrong. The problem seems sexual in nature, though the erectile dysfunction is almost certainly just a symptom of the perceived assault on his masculinity and not the actual problem. If the man found another job or another way of satisfying his sense of achievement, he would reobtain his sense of masculinity, making his ED go away. Or he can just take Viagra and wish for his life to be better. Well, when we take the time to look at a person's relationship with others and with society, the problems they experience in their lives start to make a lot more sense. I'm not suggesting that medication is inherently bad, but it often seems like putting a Band-Aid on a broken arm. Although it can help a little, it doesn't typically do anything to remedy the cause of the problem. Okay, so maybe that wasn't a great analogy, but you get the point. MFTs help clients to assess their relationships, believing the problem is not in the person, but in their relationships. Many problems boil down to the things as simple as a lack of boundaries, unspoken expectations, and people not fully expressing the things they want and need, or even feeling like they can't express these things. When you can get past these barriers to healthy relationships, you'll stop experiencing the stress that caused your overeating, or anxiety, or anything else that prevents you from feeling loved and safe, which is all anyone really wants anyway. In this book, we're not going to spend too much time worrying about your relationship with your mother, your unconscious thoughts, or that one embarrassing thing that happened to you in second grade that has stuck with you and haunted you ever since. Most of those things don't matter as much as you might think. Also, change is a funny thing. It's often indirect. Say your problem really is your relationship with your mother. Perhaps she's never been that warm, and conversation with her is usually brief and unpleasant. How likely is it that talking to her directly about your relationship with her is going to change your relationship with her? You'll bring up the fact that you want a more loving mother. She'll feel attacked and either withdraw further or go on the offensive, and you'll feel worse for having brought it up. What if, instead, you focused on the great relationship you have with your dad and enjoy that for what it is? Over time, your mom will see the two of you getting along and want to have a similar relationship with you. Your dad will tell her that he can tell you want things to be better as well. Eventually, ideally, she'll start to make an effort to have such a relationship with you. This kind of approach is explored more fully in the chapter on strategic family therapy. Now, I'll be honest. I have a limited and opinionated view of traditional psychology, and though it does work for some people, I think its overall premise is flawed. Like Dr. Glasser, the creator of reality therapy, another model we'll cover in this book, I do not feel that insight helps people to significantly improve their situations. Determining that it was your father's absence that made it hard for you to feel loved does nothing to increase your sense of being lovable in the present. Realizing that you crave the approval of a parent doesn't suddenly give you their approval, nor does it necessarily make you stop wanting it. Asking questions that help you to think of yourself and your problems in a different way, and taking directed action will help you to move forward far better than will analyzing the past, though it does have its own merit, as we'll see in the next few chapters. Maybe you know you're not happy with your life, but you never took the time to imagine the kind of life you'd rather have, or at least you came up with some excuse for why it could never happen. By getting clear on your ideal future, you can reverse engineer it and get yourself there, little by little, even if you don't yet know the next step to take. This is the approach explored in solution-focused therapy. If you prefer to be guided by your core desired feelings, as spiritual writer Danielle Laporte calls them, then the chapter on emotionally focused therapy will help you get clear on how you want to feel and how to better express those feelings to others. And if you're big on storytelling, we'll take a look at your life in the narrative therapy chapter to determine the role you play in your own narrative and how to change it if you're dissatisfied with the status quo. We'll see what happens when people feel like their problems are separate from them and how that helps them to defeat them. Due to being creatures of habit, we can easily get stuck in a rut when things veer too far from balanced for us. To a certain extent, we like predictability because it makes it easier to guarantee our survival from one day to the next. We don't get that predictability though, not 100%. Life happens, and the way we usually deal with things won't work with every problem or every time, or sometimes ever. We feel stuck when we don't know how to get in flow and step into a different point of view, or role, or whatever else the situation calls for. The field of marriage and family therapy has at least a dozen systemic or relational theories, and many more that are offshoots of these core theories. Each takes a different approach to viewing a person's relationship with themselves, with others, and with their environment. As we move through the 10 different models I describe in this book, you'll see how I used each of them to improve my life and get some practice in understanding how each sees the world. I'll point out movies and TV shows that seem to have an understanding of some of these models, and to which you can apply the models to see what they show you. You tend to find what you're looking for, so rather than looking for dysfunction, we'll try out looking for positive intent, for strengths, for resources, and for understanding. Some of the lessons I learned in this book are things I needed to work on before I can be a good therapist. I define being a good therapist as being present and attentive. I often refer to myself as a good conversationalist, but it is a frustrating habit of mine that I tend to dominate conversations. I'm not entirely sure how it happens yet, so I've got my eye out for that one. My mind is also always buzzing, making connections between seemingly unconnected items so quickly that it seems obvious to me, and yet often makes others think I can't carry a conversation because it jumps all over the place. Some of these connections are useful. Most are not. I also tend to take on too much that isn't mine to carry. People would tell me about their money problems, an illness, a heartbreak, a crime committed against them, and I thought I had to suffer for them, as though it would ease their pain. The things I've learned will likely be beneficial to you as well, but I had to learn them if I wanted to meet my definition of being a good therapist. In a therapy session, I can't go letting my mind run off to my friend who is in a funnier or crazier situation that's vaguely reminiscent of my clients, because they're not there to shoot the shit with me. I'm stepping into a new phase of my life, and it requires me to become a bigger, more expanded version of myself. My job as a therapist will be to talk with people, and there's a lot of nuance involved in that. Regardless of what you want to do with your life, knowing how to talk with other people will serve you well in so many ways, so I don't doubt you'll derive benefit from improved communication almost immediately. That said, I want to clarify that a lot of things will take time, and that's perfectly normal. Low self-esteem doesn't always change overnight. We can be working against habits we've had for our entire lives, habits that have become so hardwired into us that we don't immediately recognize when we're engaging in them. Lasting change is often slow. Awareness of our habits is the first step, followed by awareness of opportunities to act or think differently in the moment. Good habits are built one moment at a time. Responsibility, then, is a direct result of choosing the responsible option more often than not. Bill O'Hanlon refers to himself as a possibility therapist because he likes to help people see possibilities they never saw before. He has said that people tend to make decisions based on the options they feel are available to them. This is hugely important, and I think it's what the whole field of marriage and family therapy is about. The purpose of therapy is to increase the number of options people feel are available to them. You almost never have only two. So, Each chapter of this book is based on a book by one or more of the founders of each theory and one or more New Age or pop psych books, so you can get an idea of what each point of view looks like from different people who hold them. I like to think of each model as a special pair of glasses that will help you to see the world differently. None of them are any better than any other. It's simply a matter of what works best for you and your situation. I used to have a bad habit of trying to control everything, which contributed to my disdain for ambiguity. I wanted to know what to expect, and I wanted certainty, and eventually had to learn to simply accept what is. As a few of my teachers told me, you can't ever be fully prepared for what's going to walk through your door. The best you can do is roll with the punches and ask good questions. Good questions are a hallmark of counseling, of philosophy, and of self-actualizing in general. Sometimes, we just don't know that we need to ask ourselves better questions, and other times, we may be too scared to ask those questions because of what we might find. As you try on a new lens, I want you to take a moment to try to actually see the world as I describe the view through them. My teachers harped on the idea of not simply using the techniques of a model, but to truly operate from the assumptions. Therapy is not just a catalog for isolated methods of problem solving. The techniques flow naturally from the worldview of the founder of the model, as well as its practitioners. There are already people who more or less seem to operate from each of these models of therapy, though they may not know it yet. Identifying the primary lens through which you prefer to view the world will help you act with more consistent conviction and ask the questions you need to ask yourself. When you recognize that your partner seems to operate from another model of therapy, you can learn to step into their shoes and see the world from them better. A good therapist doesn't try to force people into a worldview that doesn't work for them, but instead helps them from the model that seems to most closely match the client's worldview. You just have to meet people on their level sometimes. I'm gonna switch up my metaphor here for a moment to explain how these different worldviews work in relationships. Each person has their own primary worldview, the way they naturally view things. Like how the wand chooses the wizard, you'll find a model that seems effortless and you're able to make magic happen with it. Your partner may have a primary worldview that's wildly different from yours. Harry Potter fans will recall that using another wizard's wand will not work as well as using your own. But in a relationship, you kind of have to learn how to use your partner's wand. It will likely feel weird at first, because you're not used to thinking about things that way. The more you use their wand, though, the more you can understand why that wand appeals to and works for your partner. You'll understand where they're coming from when they approach a problem, and they'll do the same with your wand. You'll both be able to snap into each other's worldview as needed, so you can feel like you're talking about the same thing as you discuss your relationship. Anyone who's had a fight in which it seemed like you and your partner were having two different arguments can appreciate being able to be on the same page for once. Counseling is both an art and a science, but so is life, really. Real human interaction is something that is becoming harder and harder for some of us. Screens enable the honesty we may struggle to voice in other parts of our lives, but they also rob us of the intimacy that should accompany such honesty, so I'm not convinced it's better. When you talk with someone, you have to be engaged in real time, and there are unspoken rules of social etiquette to adhere to. It can be really hard to be completely honest, present and genuine in a face-to-face interaction, but such are the requirements for meaningful connection. The vast majority of us, like 99.9% of us, crave meaningful connections in some form, and yet we're scared of trying to establish them. We claim to be more connected than ever, but what we're really saying is that we're connected to our phones. My grandpa jokingly reminds us that they're called cell phones because they're like little personal prisons. Call me a hater, but I don't think any technology fully compares to the experience of looking someone in the eyes and telling them what's really weighing on your mind and your heart. Brené Brown asserts that vulnerability is necessary to build true connection. I don't want to make you feel attacked or overwhelmed by this. It's just a matter of fact that technology has affected how we communicate, and we're still figuring out the long-term implications of the technology we use. Communicating meaningful information clearly and effectively often requires a certain level of skill, which can be either inherent or practiced. Figuring out which model's assumptions align most closely with your worldview will help you to refine your approach to connecting with others, with yourself, and with the world. You'll find some validation that the way you think of things is indeed backed up by science, and then recognize that using the model requires some finesse, some of your individuality. When you can communicate more effectively, people will get to know you better, and they feel more comfortable with you due to your own self-assurance. Most MFTs do not believe that you need the whole family to make a change. Because of our immense interconnectedness, a change in one part of the family system leads naturally to changes in other parts of the system. Changing yourself becomes a ripple that changes how other people view themselves and how they view their interactions with others. If you feel helpless in your family, or you're struggling to practice patience or forgiveness with your partner, you may be wishing for others to change, and if that's the case, you're wasting your energy. Sometimes you have to change yourself to rise above the situation and trust that others will grow to meet you. Even if they don't, you will have developed the strength and self-love to recognize whether you need to walk away and to do it if you have to. Improving yourself is always a good option because you're the only person you can control anyway. That said, successful long-term relationships involve growing together. Not every relationship is worth saving, such as when one person isn't as willing to grow, or when partners just grow in different directions. MFTs want what's best for everyone involved, and this doesn't always mean staying together. When one or both of the partners are stifling the other's growth, it may be time for them to part ways. Now, it seems to me that most people mean well. They want to be kind to others, and for others to be kind to them. Good intentions are not enough, though. Not when some people have learned bad behaviors for establishing connection, or information they've come to accept as true that limits their view of all humans as having inherent value. To love someone is to accept them as they are, regardless of your understanding of them. I can't understand what it's like to be a trans person, or a woman, or a person of color, because I'm not trans, nor am I a woman, and not even a blind person would think I had any color. I'm as white as they come, and as I write this book, I am very aware that my problems as a white male who is gay, but is often perceived as straight, may be the problems other people only wish they had. I can't change any of these things, and I can't spend too much time feeling bad about any of them either, because it doesn't do anything useful. The best I can do is try to recognize that everyone around me has their own experiences and view of the world, and that they're both shaped by each other. No one can ever fully understand me, nor I them, no matter how hard or long we try. So it's easier to simply accept that what's true to them is true to them, regardless of what's true to me and how it may differ. There are obviously some big political and economic issues that hinge on what people believe is true about them, and the models of marriage and family therapy can often be applied effectively to socio-political issues, but that's not what we're here to discuss. I hope that someone reads this book and feels capable of applying these models to such issues. That would be really cool, because these models can be applied in lots of situations, and I want you to let your imagination run wild as to where they are used or could be used. I'm going to teach these models in the context of self-improvement and a two-person romantic relationship, but I want to make perfectly clear that these are not the only contexts in which they are effective. In a romantic relationship, you need to know that you and your partner or partners can learn to see things from each other's point of view and use this to solve problems together. Even if you don't agree with their point of view, and no matter how strongly you believe that yours is best, remember to accept that they are entitled to their worldview, and then figure out how to navigate the differences between the two or more of you. I don't think that most people who go to therapy are truly as broken as they may think they are. Humans are incredibly resilient, and there are movies and songs that remind us of what the human spirit can endure and rise above. I think people typically just need some direction and a little push. As someone who has struggled with depression, I can find myself in a deep, dark hole sometimes and not even know how I got there. It's hard to think long term, or even just get unstuck when all you can see is the absence of joy and hope surrounding you. When you know where you're going, as best any of us can, of course, it tends to be easier to figure out how to get there. Therapy can teach both better behavior and communication, which can help people who may think they're going in a good direction or taking the best approach when they're just not. Like I said, good intentions aren't enough unless they're accompanied by rational and loving behavior. In life, as in therapy, everything is on a case-by-case basis. There aren't that many hard and fast rules, like, when X happens, do Y, and if A, then B, because people are complex and situations are rarely black and white. There is so much nuance to being human, and I don't think most of us appreciate that enough. As I have expressed already and will continue to echo throughout this book, I cannot tell you how you should think or feel or act, because I am a different person from you, and I cannot rightly presume to know what's best for you. I try to live my life, guided by my personal mantra, just don't be a dick. It works for me, and often results in me extending a helping hand to others, but even when it doesn't, if I'm not hurting anyone, I'm doing a halfway decent job as a human. The other half, of course, is focused attention on the problems I can do something about, but I can't tell you what to care about or how to care either. That's something you have to figure out on your own. In each interaction, with each person in your life, you have to decide for yourself, how do I want this interaction to turn out? Do I care what the other person thinks about me or feels? If so, do I want to do anything to influence this? Regardless of whether you explicitly ask yourself this, anyone who's ever had a crush knows what it's like to care about a specific person's opinion of you. Whether your colleagues' opinions of you matter most, or you're driven by the support of your romantic partner or a parent, you inevitably take some people's opinions of you into account when making decisions. As long as you're happy, there's no one right way to handle everything. Each of these models of therapy is roughly equally effective. Studies have shown that the most influential factor in whether positive change occurs in therapy is the client's desire to change. After that, the strength of the relationship between the therapist and client has a lot of influence. The model of therapy used simply guides the direction, but it does not typically have enough impact to be the determining factor between successful and unsuccessful therapy. What I'm trying to say here is that there is no best approach, and you'll have to try out a few lenses to find a good fit. Even then, you might have to try others on a few times more before they start to feel natural. You're learning to expand your repertoire for ways of viewing the world because it'll help you to learn how to fit in any situation better. Shop around. Take your time. Remember, these models will not make the situation worse, so just as there's no right choice, there's also no wrong choice. Necessary disclaimer though. If you're with someone who's absolutely no good for you, such as an abuser, your attempts to make your life better may make the other person upset. Sometimes there's no reasoning with people who don't deserve an explanation from you. If you need to walk or run away, figure out how to do so. Please do so safely. Each model is a different direction you can go in, and any one of them will lead to change in one part of your life that will, in time, ripple into changes in other parts of your life. As you'll see from my experiences, the use of these models can be fluid and individualized, and as you learn to let go and trust the process, you learn so much more about yourself and those around you that you just find yourself enjoying being in process. I learned the science of therapy in my master's program, and the books I'm reading and my attempts at incorporating the models into my life is where I'm really enjoying myself. I've always been a creative person, but never considered myself an artist. My writing has been almost exclusively academic up to this point, and I'm just now embracing the reality that I can be the writer I've always wanted to be. The chapters that follow alternate in describing the models and my experiences with them as I try to make sense of how to make each one fit a different area of my life, and how some of them work in areas I wouldn't have expected them to. I can't deny my personhood and the experiences I've had that have shaped who I am today, so any method of trying to improve my life should take these into consideration. I'm a thinker and a writer, and I'm enjoying turning my experiences and my understanding of them into a book that's as dynamic as I am. Having tried on each of the lenses we'll discuss, I've developed a new view, one that feels more authentic now that I know what else is out there. I feel both more focused and more relaxed, more driven and more content. It is my sincere hope for you that as you try each model, you learn something about yourself. In determining who you are or want to be, you must also determine who you aren't or don't want to be. Remember to not try to change others, because it'd be a wasted effort, and to not change yourself to match with someone who's not a good match for you. There's something so sacred about staying true to yourself. I've identified my primary lens for viewing the world, and now I'm enjoying trying out others from time to time, just to keep myself sharp. These different views help me appreciate all the nuance that accompanies the human experience. What I once tried to control, I now simply observe, and in doing so, I feel more powerful. I am becoming the person I'm meant to be, and though that will look different for every one of us, if you allow yourself to enter the process of becoming the person you're meant to be about what does and doesn't matter, when you learn to let go of all the bullshit that's weighing you down, you find yourself with the energy and focus to do the things that matter to you with the people who are best for you. I don't know what's going to speak to you most, but I'm confident that you're going to find what you're looking for and that you'll listen when your soul tells you that you have found it. There's hardly anything more personal than therapy. It can be difficult to open up to a stranger about the things that you're most embarrassed to talk about. Trust me, I get that. That's undoubtedly one of the biggest barriers to therapy, though fortunately, it's a hurdle you won't have to overcome in reading this book. You're going to have to be more honest with yourself than you'd probably like at times, but you don't have to spill your guts to anyone else if you don't want to. Each model will ask something different of you, and the chapter will be accompanied by an activity that helps you get better acquainted with it. When you're working on them, it's you who's going to benefit most from you digging deep and answering honestly. People often think of therapists like doctors, and that's another barrier to effective therapy. Doctors are often highly respected in our culture, and many people take their advice very seriously. If they have a chronic illness or disability, they're likely going to heed their doctor's advice because they know the doctor knows a lot about their condition, so that people often think of therapists like doctors, and that's another barrier to effective therapy. Doctors are often highly respected in our culture, and many people take their advice very seriously. If they have a chronic illness or disability, they're likely going to heed their doctor's advice because they know the doctor knows a lot about their condition, so there's not much room for debate. That's not the case with therapists. Therapists discuss things with you and help you see things differently so that you can make different choices moving forward. To clarify, here's a list of what good therapists do not do. They don't give advice, solve your problems for you. They won't have the tough conversation you've been avoiding with your spouse, friend, or coworker. They won't think they're better than you, laugh about you behind your back with their therapist friends, or make you feel dependent on them. TV and movies, and sometimes even books, do not typically portray therapists accurately. Of course, the show is going to be more exciting with the therapist who plays by his own rules, or it's dramatic to see a therapist hidden in shadows but is still so alluring, or funny to see a cavalier therapist who shouldn't be licensed, but none of that is real. Therapy isn't what it used to be anymore either. To balance out the idea of a good therapist, here's a list of what they will do for their clients. Pay attention to what you say, as well as how you say it. Call attention to your body language, especially when it contradicts your words. Ask questions you may not have considered, and offer a new way to look at your problems. An MFT is essentially a relationship coach. Think of what coaches do. They pass on their training and wisdom to guide you to become better. They show you how to do new things and then have you do it yourself. You learn by doing and by figuring things out for yourself. The basketball coach isn't in the game making three-pointers from midcourt to help their team win, but they give them an outside perspective and point out things they could improve on. If it helps you with the sports analogy, imagine that the coach is teaching you and your partner or family how to work together as a team. You may often feel like it's you versus them, but in successful relationships, the partners are always on the same side against their problems. Therapy is getting harder and harder for people to access because their insurance doesn't cover it, or if it does, it doesn't cover enough sessions. That's if people even have health insurance, and if a therapist takes insurance, which many don't. As such, typically, therapy can be seen as something only the rich can afford, while they talk about their rich people problems that many of us can't find the sympathy for. It's hard to feel bad for people who have more money than you. Think about it. Maybe you loved Lindsay Lohan as Katie Heron in Mean Girls and Charlie Sheen in 2.5 Men. But did you really feel all that bad when their lives fell apart in front of our eyes? My point is, some may claim sour grapes when they think about therapy, but it's quite possible people are writing off its usefulness because they're bitter they can't afford services. This brings me to my last point. You don't need a therapist. It seems to me that too many people give their power away too easily. I've known a lot of people who wished for someone else to swoop into their lives and save them from themselves, but life doesn't work like that. In most situations, we do not need someone else to save us or fix us because we are far more capable than we give ourselves credit for. Therapists can be revered or feared when they are seen as having all the answers, and people will throw themselves at their feet, so to speak, in hopes of hearing the advice that will solve all their problems. Modern MFTs believe that clients are the experts on their own lives and help their clients find the answers within themselves. The models of therapy are means of gaining some measure of clarity, but that doesn't mean they need to be difficult to use. There will certainly be times when you will need to enlist, likely as often as you expect. With the right tools, humans can do some pretty amazing things. It's a shame that our health is something we don't typically value while we have it. I greatly appreciate the focus on prevention that the healthcare company I worked for is known for. They believe that it's easier and more cost-effective to maintain good health rather than try to recover from illnesses and diseases that could have been prevented. That same preventive approach can be used in your relationships or your personal life for the same reasons. It's not very likely you'd go to a therapist while things are going well, but the information in this book can be used proactively, like preventive mental health care essentially. It's easier to build good habits before you need them, and far more difficult to learn when we're distressed. We don't need to wait for the affair to happen before deciding to make changes in our relationships. We want to have happy, healthy, fulfilling relationships, and those take some work. Small, consistent actions toward change add up over time and are much easier than working through betrayal and disappointment. I used to think that being alone was the worst thing that could ever happen to me. Being alone can be a scary idea, and the fear suggests that we need someone else to make us whole. Working in a medical facility, I see a lot of people who are scared. I think one of the deepest fears I've observed is that the person we love most will leave us after an illness or injury. We want to know that people who love us will be there for us in our time of need, and we're so scared of not having that. Having people helps make life more bearable and enjoyable, but fear tells us that without others, we cannot tolerate pain or find enjoyment. This is entirely untrue. We are all already whole. Operating from a place of wholeness, we don't burden our partner with unfair expectations. Instead, we're able to enforce boundaries, effectively telling each other, "These are the behaviors I require if you want to have a place in my life." When we know what we deserve, we don't accept less. We appreciate our partner more, and we don't try to control them. We are all capable of having the relationships we want if we can let go of the fear that is standing between us and those relationships. By the end of this book, you'll know how to kick fear's ass so many ways you'll wonder why you ever doubted yourself. As you move through the book and try using the different models with different problems in your life, both big and small, celebrate every victory. Cheer yourself on, even if you feel stupid doing it. You deserve to be told how awesome you are for continuing to step out into the unknown and doing your best to move your life forward. Brendon Burchard says that confidence doesn't come from past successes, but from what we tell ourselves. Tell yourself you're capable, because you are. If you can read this or have the ability to hear, you have more going for you than you think. Tell yourself you're strong, and watch as you start to believe yourself. Tell yourself you're whole and valuable, and insist that others appreciate your wholeness and recognize your value if they want to be in your life. You have to believe that you're capable of changing your life for the better, and believe that you deserve that life if anything I say in this book is to stand a chance of helping you. I'm telling you from personal experience, it can be hard to believe that these things are true when you're so used to being told what's wrong with you. Having flaws is part of being human. Focusing on them will only remind us to play small. Choosing instead to focus on our strengths, and we all have many different strengths, will allow us to shine and step into our fullness. I'm asking you to look for and celebrate the good in yourself because you have to see it and value it before you can expect anyone else to. And you deserve to be celebrated.